I think you have to have the ability to take qualified risks. I think a person who plays everything too safe is always wants to reach some kind of consensus or wants to have everybody else weigh in and then chooses the solution that seems most popular is probably not going to be a terribly effective leader. I think that you have to be able to take qualified risks, not foolish risks, qualified ones.
Welcome to the Health Leader Forge. My name is Mark Bonica, and I'm an associate professor in the Department of Health Management and Policy at the University of New Hampshire. Today's guest is Paul Forte, the CEO of FedPoint. FedPoint is a fast-growing provider of benefit administration and technology solutions for large institutional sponsors with a focus on the federal government of the United States and its numerous departments. In this podcast, we talk about Paul's unusual career journey to become an insurance executive. He first earned a PhD in Renaissance English literature before making his way into the insurance industry. Paul began working in the long-term care insurance space in the late 80s and has been a leader in the field for decades. Not only has he led FedPoint's growth, but he has also published a number of articles making recommendations to the industry on how to reform long-term care insurance to make it more affordable and sustainable. We close on a discussion of leadership. I hope you enjoyed this podcast, and if you do, won't you leave us a rating on iTunes, Spotify, Substack, or wherever you may be listening? It helps other people discover us. Thanks for listening, and here is Paul Forte. Welcome to the podcast, Paul.
Thank you. I'm pleased to be here.
Looking at your background, you have a really unique background as an insurance executive. You are a fellow graduate of the University of Massachusetts at Amherst, as was I. But you have a PhD in Renaissance English literature.
Yes.
Tell me about how did you come to pursue a PhD in Renaissance English literature?
Well, I knew I was going to. I was always interested in public speaking, and I was interested in language, and I knew when I went to the university that I would probably be an English major, although I did take certain detours into comparative literature and intellectual history and even Greek for a time. But I eventually finished as an English major and wasn't sure what I wanted to focus on because the more I read, the more I got interested in. But eventually I got around to the literature of the Renaissance, and especially I didn't want to do. There was an awful lot being done on poetry, and of course the Elizabethan drama and Shakespeare, and I was more interested in prose. There was a tremendous amount written in prose that was not getting a lot of attention. One of the reasons was probably that it had to do with religion. Now, I should point out that I am not a religious person, so my interest in it was not because I was interested in religion. My interest in it was because I was really captivated by the thought and expression of the period, and a lot of it had to do with religion. But I perceived fairly early on that when people were talking about religion, they were often inadvertently talking about politics and the best way to organize society. And so that's how I kind of got into it. And it was almost serendipity, but I found out about an edition that was being prepared. It was a 30-year project, and it was on the writings of Richard Hooker, who was a great Elizabethan theologian and philosopher and an absolute master of prose. And I called the fellow who was running the edition, the general editor, and he was a wonderful man. He invited me to kind of join him, even though I wasn't studying at his school. I was at the State University of New York, and he was at the City University of New York. And I managed to get an intercampus fellowship to go and study with him. And then one thing just led to another. And it was really a fascinating fascinating experience of working with him and the other editors who were an international team of very, very fine scholars, political philosophers, theologians, rhetoricians, text editors, historians who knew the period inside and out, backwards and forwards. And so that's how I ended up doing it. It was not a terribly marketable subject,
Yeah, yeah.
and as you can already surmise. But I cannot speak too highly of it as an intellectual experience. If I had written my dissertation on the novels of Dickens or Twain, I might have become an academic. But I didn't. And yet, the challenges associated with trying to understand a figure like Hooker, who was sort of at the crossroads of the Reformation and the Counter-Reformation, to try to understand all him, I had to study a number of disciplines. Of course, Reformation theology and Reformation history, the Tudor Constitution, but also things like the common law tradition of which he was a part. And because he looked forward something to contract theory and John Locke, a number of figures in the 17th century. So I was very well prepared in that sense, but not a lot of people were interested in what I had to do. By the way, I will just say this, and we can move on from this subject, but I have, since that time, always found important insights and parallels. During the last 30 years, where we've had a number of terrible incidents, that caused by religious fanaticism, I've often looked back to the time I spent with Hooker, because he was very interested in the problem of authority. How does authority get established? Where does it come from? Is it something that you get from some, divinity? Is it something that is arrived at by consensus? Is it tradition? Is it because somebody who has some title tells you that is what should be? And I see Hooker as one of these very sane, beautifully organized thinkers who should be more widely read. That if he were more widely read, there might be a little less fanaticism in the world.
Well, that's great. So the fact that the subject fascinated you because it had this diversity of feeds into it. You said politics and history and philosophy, right? All coming together.
Mm-hmm.
So you finished your PhD, and how did you make the leap from Hooker to insurance?
Well, I'll tell you, it was not fun. As I've already hinted, what I had done was not especially marketable. But then again, in 1980, it was one of the nadirs of U.S. higher education for humanities, and especially English PhDs. There were only a handful of jobs in the country, and I had done what was perceived to be a somewhat esoteric subject, and it wasn't terribly marketable. So I taught rhetoric at English composition and some other courses at the University of Massachusetts at Boston and Suffolk University, and I did some little stints at Boston University, and I wasn't making any money. I wasn't really getting anywhere, and so I had to go looking for work. And I had an aunt who happened to be working in a clerical capacity for John Hancock, and she would say to me, why don't you go and apply? And of course, I was appalled at the idea, but she pressed me. She kept insisting, and as the months went by, and I turned up nothing, she would renew the question. And then finally one day she says to me, "Well, you're too proud to do that, aren't you?" And there was a bit of truth in that.
Yeah.
And Next thing I knew, I had gone to apply for work at John Hancock, and of course, they didn't know what to make of me either, except one person did, and his name was Derek Chilvers. He was the
Okay.
vice president of the international group, and he was a very well educated, distinguished man who had traveled all over the world, and he had built this business that had to do with the pooling of group insurance contracts through other companies around the globe. And he had done his work. He had a master's from Cambridge, and he had studied if I recall correctly, the work of Camões, the great Portuguese epic poet. So he hired me.
So
And
your background must have resonated a little bit with him then.
yeah, he did,
Yeah.
yeah, and he had his own plans for me, and I guess he thought that I might be helpful, and I started kind of as a scribbler, as someone who was writing reports, and pretty soon I had a sales territory. I wasn't too wild about that, but I was becoming kind of a department resource for anything that had to be written that was difficult and required high standards, and but I realized that after a time, if I was not careful, I was going to be pigeonholed as a sort of writer-editor type. And unfortunately, in big corporations, those people don't pick up, they don't get the best salaries.
It seems
So,
like that would be a natural pigeonhole for you, given your,
yes,
it is how you have a PhD in English. I mean,
yes, yes. But again, I realized that
but
if I did that,
some motivation to go beyond that.
yes, I did. I wanted to make a decent salary, and I felt I had some leadership and some managerial abilities that would not be fed by such a discipline alone. And so I started getting into we call the techne, the actual technical aspects of the business. And it was difficult, but over time, you get things. And I had a chance to get into the long-term care business in 1987, about 5 years after I joined the company. And that was a very, very hot area at the time because of actually, the kind of issues that you called my attention to in that New York Times article.
Yeah.
Really hasn't changed. In almost 40 years, this country's been talking about the aging demographics. We knew from the census of 1980, and certainly from the census of 1990, that a disproportionate number of people would be over the age 65 someday, and that they would require a range of support services. And that if they didn't get those support services, they would be in trouble. Moreover, those support services were very expensive. And then there was the question of how they would pay for them. And that's where the insurance angle came in. And a lot of people were very excited in the early years of long-term care insurance about being able to get policies into the hands of millions of people who would have some protection against the high cost of long-term care if they became disabled, either through debility or some kind of cognitive impairment. And so I was fortunate enough to get involved in that. And it was a market that was growing very quickly. There were over 100 insurance carriers in the United States that were active, quite a few third-party administrators, various nursing and other organizations that were, anxious to work with the private insurance business, or private insurance industry, and so forth. So it was a great thing to get into, and that led to a series of promotions.
So, what was it that caught your, aside from wanting to make a little more money, what was it about insurance that actually grabbed you? Because it's clearly you have a passion for that too.
I always thought that if I was going to work or sell something or be involved in a business, it would have to be an intangible. I never really wanted to deal with things that were physical, that were, whether it was computers or cars or some of the kind of hardware or, consumer goods, food. I was not interested in that, even though I knew that some people, especially, for example, in pharmaceuticals, did extremely well. And I might have actually flirted with pharmaceutical sales for a while. Now that I think of it, I didn't do it. I think that one of the things that I liked about insurance was that it was very challenging. It required study, and also it required an ability to communicate, because all you had was an abstract idea, or you were going to present an agreement to somebody. And if you couldn't use language well and precisely, you would not be able to do it. And with a newer product like private long-term care insurance, communication was really, really important. The skills around writing, describing, promoting, and so forth. So I was able to use, some of the background that I had acquired over the years in the university to pretty good effect. So that's probably how I got into insurance. And insurance also is one of those things that it's funny, if you talk to a lot of people, once you get into it, it's not easy to leave it, because it requires a lot of you in the early years. And once you start to acquire this body of knowledge, a lot of people find they're reluctant to give up what they've acquired in knowledge in order to change to another field. If that makes any sense.
Yeah, sunk cost is what we call
invested. Yes, sunk cost. You're invested, and so then it might be, well, maybe a different line of insurance business. There's also the whole business of of risk management. What is risk, and how do you take it, and how do you know that it's safe to take it, and what are the mechanisms that you can use in order to cover the risk that you're agreeing to write without losing your shirt in the process. Mm-hmm. And there should be it's got to be fair. It's a proposition that should be equitable. If the future is unknown, it probably will be it will be equitable. But I think that at the same time, you've got to protect the company that you're writing for, and your colleagues, because huge losses can have a deleterious effect on everybody around you.
So you were in long-term care starting in about 87.
Yes.
So you were in it for quite a while before John Hancock joined up with MetLife to launch the company that eventually became FedPoint.
Yes. Well, it's no accident. I mean, John Hancock, I was part of a group that made John Hancock the top underwriter of long-term care insurance in the country. We're absolutely the best, particularly in the group field. We were absolutely the best. And Met was a close second. But Met had that we didn't, was Met had been working with the federal government for a very long time. They had written the big federal employees group life insurance program since the late 1950s. And so they had a lot of experience with the federal government. Hancock didn't. Hancock had tremendous capabilities in the group long-term care insurance business. Met did to a lesser extent. And so that's how that partnership came about. But it was 13 years of hard work before I was in a position to really be part of the joint effort to write the federal program.
So at what point did John Hancock and MetLife get together to say, hey, we need to create this organization. We're going to join up together. What was the impetus to create the company that later becomes FedPoint?
Well, to step back just for a moment, the federal government had been watching developments in the long-term care insurance business, particularly in the group insurance arena. A number of major companies, IBM, all of the baby bells, Procter and Gamble, the big pharmaceuticals, they all put in some kind of a sponsored group long-term care insurance program. The universities, City University of New York, Harvard, others also put them in. And then there was the CalPERS, the California pension system. They put in a program. Now, the federal government had been watching this for a while, and by around the late 90s, it started talking. There was talk going on the Hill about whether the federal government shouldn't offer such a program to its own employees and retirees. And both Hancock and MetLife were, following this closely. And when the legislation actually was passed, the Long-Term Care Security Act of 2000, and signed into law by Bill Clinton, President Bill Clinton in 2000, in September of that year, we were off to the races, and we knew there would be a big bid. We knew that the bid would be very comprehensive, and the federal government also knew that the program could be very big. And so they thought, well, perhaps we should allow consortia of insurers to join together for purposes of writing such a contract, as opposed to saying there can only be one insurance carrier. And they thought that might intimidate and discourage participation in the bid. So Hancock and Met decided to work together. It was very unusual because these two Northeastern companies had been beating each other up in the streets for over 100 years. And there was a lot of talk about antitrust. I remember before we could have any meetings, we had to read these antitrust statements and, swear to all these particulars. But we started to talk about building this consortium, and I became the chairman of the steering committee for it. And then pretty soon there was the talk about, we should form a company because the feds are going to want to see a company. They will be confused about how it will work if there's not a single entity, and that single entity became Long-Term Care Partners. And then after that was formed, I was named to become the CEO of that joint venture, and that was in 2001.
How big was the organization to begin with?
Well, strictly speaking, in terms of the numbers of people we actually had working directly for us, probably 50 people. But there were many people in the parent companies that were working with us in that time period, hundreds, in fact. And by the time we actually launched the first enrollment, we probably had several hundred people because we had many people on the phones. In fact, the first enrollment was one of the largest sort of promotional campaigns for long-term care insurance in history. And it went on for almost a year. There were more than 1 million calls. Everything was very large numbers.
So the company was originally Long-Term Care Partners, later becomes FedPoint. What did you actually do? So there's a law, the government has contracted with you. So what is Long-Term Care Partners doing at that time, and what do you do today?
Well, we are not an insurance company. That means that we cannot actually underwrite risk ourselves, and we cannot take the premiums associated with the risk that we are assuming. We can't invest those premiums. But that's properly what an insurance company does. Think of us as a pretty comprehensive third-party administrator that handles a wide range of activities. In marketing, enrollment, premium administration, we interact with more than 100 federal agencies to deduct from payroll the premiums associated with whatever program we're talking about, reconciliation of those premiums to make sure people are paying the correct amount, processing changes, underwriting applications, which means reviewing them for medical evidence, paying claims, ensuring that there is tight security around PHI and PII, making sure that we have the infrastructure necessary to process all of the data and share that data with the federal government and with other stakeholders. So those are some of the things that we do. We also have a team of about 40 nurses who do what's called, on the long-term care program, care coordination. These people are the people who actually determine whether you are eligible for benefits in accordance with certain criteria, either, criteria that measure debility, for example, the activities of daily living. Can you dress? Can you bathe? Can you eat by yourself, and so forth? Then there's also cognitive functions. Are you in any way impaired such that you cannot perform any of those functions, or you cannot be safely left alone, or you might be apt to wander out of the house and become a danger to yourself or others. So this group of nurses, all RNs who have trained in clinical settings, they work for us. And what they do is they make the assessments, they work with people and their families, they talk about, try to get a bead on what the nature of the problem is the person has, and make suggestions for the kind of care that might be best for them, whether it's in the home, it's in an assisted living facility, perhaps even a nursing home. And then if it's a nursing home, do they have to be in a dementia ward, or can they be in something less restrictive? So those are among the activities that we do on the long-term care insurance business. And I hope that clarifies our administrative role.
Yeah. Do you work with other insurance companies then that actually take the premiums and invest them, or how does that work?
Yeah, well, in the beginning, of course, everything was split between John Hancock and MetLife. So the premiums had to be sent to both of those companies, and they each invested them in accordance with a guide or a series of agreements that the federal government had reviewed and approved. So we have to be on top of everything our current parent company, John Hancock, does. We have to know everything they're doing. We often have to sometimes translate for the federal government in basic language what it is that they're doing. And so we're involved in virtually all aspects of the insurance business. It's just that we don't technically have the legal authority to assume risk, to issue what's called paper, a certificate of insurance, and or invest premiums that are associated with the liability.
So you process all the applications. Do you also determine rates that are appropriate, or is that done by the insurance company?
When if you're the insurer, you have the prerogative of establishing the premium that you believe to be necessary in order to cover the risk. And that's what you're willing to do contractually. Of course, because this is a kind of risk-sharing program, the federal government has a say in what those premiums look like. There's a lot of, debate that goes on behind closed doors about what those premiums should look like. And there are some unusual aspects to the federal long-term care insurance program that make that important. For example, it operates almost more like a trust fund, where if expenses are capped, profits are capped, and if there are any gains, for example, from lower expenses, or underwriting, or anything, or investment, those gains go into that fund, and they work to the benefit of all of the enrollees, now around 260,000 people. They do not accrue to the benefit of Hancock or of FedPoint.
So does FedPoint only do long-term care, or do you do other programs as well?
Several other. We do premium allotments for the flexible spending accounts program. We have about 500,000 people in that. We don't actually work closely with individuals or do customer service support, but we're the ones that, again, we have very strong track record with the payroll offices of the federal government, more than 100 of them. They're very comfortable with us. So we're the ones that will take out of people's paychecks the amounts of money that are associated with a flexible spending accounts program. And then significantly, we are also the people who really created the platform on which the Benefits program runs. That is the program that operates the Federal Employees Dental and Vision Insurance Program, FedVIP. And there are now, we have some 6 million enrollments on that platform. So it's global. I mean, we have altogether, we're covering some 7 million people around the world.
So if you've had this contract then and grown the contract to some degree, it sounds like, since 2001. So has it been continuously?
Well, we have the Federal Long-Term Care Insurance Program has been ours since 2001. The Benefits contract has been ours since 2006. The FSA program since 2005. So we've had these other programs going on, 17, 18 years. And, and they've been very, as I said, they've been very, very successful. And we look to expand. One thing we did a few years ago that I was pleased about was that we were able to take almost 1 million military retirees who had been part of the old Delta dental insurance program, and we migrated them over to the Benefits program pretty much without any trouble at all in a matter of months. And they're all now part of the benefits of the FedVIP program. So overnight, because we had always had military people in the federal long-term care insurance program, anywhere north of 20,000 people, but now we had like 1 million military people, and so that meant that we needed to step up our knowledge of military culture and military preferences and how best to interact with them. I'll just say one thing that's rather interesting about these programs is that, particularly on the FedVIP, often with employer arrangements, when you retire, you will surrender your benefit package and you will go on to Medicare, or you'll perhaps get some of the kind of coverage. With programs like the FedVIP, just because you're retired doesn't mean you have to drop out. But meanwhile, so you have like tens of thousands of people that are retiring every year. They don't necessarily drop out, but the federal government's hiring another 7,000 to 8,000 a month. And they have to offer these programs to them. So that's how the numbers just keep growing.
So it sounds like, talking about growing the business, the thing that has ensured your success has been kind of creating this track record of being reliable, secure. It sounds like a different kind of business, right? I mean, rather than pursuing marketing to maybe individuals necessarily, you really have one big customer in a sense that you have to convince, and your performance metrics are primarily around security, of course, and reliability.
Mm-hmm. Yes, and that brings with it both opportunities and challenges. If the federal government is into a mode where they have authority to extend benefits to new groups, as they did with the TRDP, the TRICARE Retired Dental Plan people, then and you have an opportunity to bid on it, it's great. But if they don't have anything going on, now you're somewhat more limited. And I think one of the biggest challenges for us is growth, because everything that we do is kind of geared to outsized events, very large national enrollments. We're not, if you want to pardon the crudity of this, but we're kind of like, we're buffalo hunters. We don't chase rabbits. And so, everything we do has got to be on a very large scale. And so and getting new institutional clients on a large scale is a challenge. We are working on several things that may eventually lead to contracts from the Department of Defense and some other areas, but it is a challenge.
So I wanted to talk to you about long-term care insurance, so I can share with my listeners here a little more of an understanding of what it is, how it's different from other kinds of insurance programs. And
Sure.
you wrote a great article called realigning LTCI, long-term care insurance, private
Yeah.
long-term care insurance, and the healthcare continuum. So I'm going to draw some questions from there. I'll post a link to that article in the show notes when we're done.
Sure.
But what is long-term care insurance and why should people get it?
Okay. Well, and then I'll try to give you the context for that article. Long-term care insurance is an agreement that you can enter into either as an individual or as a group or as a member of an association, whereby you will pay a premium, and for that premium, you will be protected against the risk of your one day needing to purchase services or supports due to a debility or to a cognitive impairment. Now, there are different statistics you can look at, but, a lot of people will say that roughly a third or a half of everyone who gets to be 65 will need some kind of care. Some people put that number higher. So it's something that happens quite frequently. Those of us who have elderly family members may have already been through the process of watching a loved one start to decline and need more and more support and more attention. And if you're raising a family or if you're living far away, that means you have to bring people in to help you out. And it's extremely expensive. And so a lot of insurers decided that this would be a good thing to offer. And I mentioned in the article that there were at one time something like over 100 insurance companies are offering some form of private long-term care insurance. Now, one thing that I think the industry did not do maybe as well as it could have was to maintain its ties with the health care community, which may seem a little strange because obviously long-term care is that care which you need at the end of your life, and it's directly related to the way that you take care of yourself in your 40s, 50s, and 60s, and whether you've had accidents or whether you've had serious health or you've been exposed to toxic environments. But the way it started was a lot of the health insurers, a lot of the life insurance companies that were in a position to write long-term care insurance, they got out of the health insurance business. It was not profitable for them. And they thought, well, gee, if we do this long-term care thing, we can kind of present this as a kind of financial package, an estate planning mechanism. And that's what they were pretty much concerned with doing. And so they issued policies and people paid for the policy, often at a younger age. And then, they didn't really hear from the insurer, and the insurer didn't hear from them for a very long time, maybe until there was a claim. And that's been one of the problems. I think that there needs to be greater alignment between long-term care insurance and the health care, what I'm referring to as the continuum. All those things that you will move through and need to do as you move through your 40s and 50s and 60s and 70s. All the supports and services, wellness, and so forth. One of the things that makes long-term care insurance different is that it is written on a kind of long-term level premium basis. And I don't know if you had a chance to read about this, Mark, but with a lot of forms of insurance, term insurance, you pay a premium for this year. Your coverage ends at the end of this year. Everything that happens this year will be taken into account. If there are no claims, maybe you don't get an increase. If you have a lot of claims, maybe there'll be an increase. Expenses, inflation, all these things. With long-term care, you're actually taking a bet, if you will, on an event that may not happen for 25 or 30 or more years out into the future. And there are a tremendous number of assumptions that go into it. And some of the assumptions have been very good and have been right, and some of them have not been so right and had to be changed, which is why you read about these rate increases on this particular line of business. And they were talked about in that New York Times article.
Yeah. Yeah. Can you give an example of like, what are you talking about when you say, there's these assumptions out there? Like what kind of?
Well, okay, so let's say we have to make it simple, we have 1,000 people, and we're going to insure them for long-term care risk, and they're all 50 years old. Okay, well, if of those people, a certain number will perhaps die before they're 60 of an accident or some illness. Others will live to be 80 or 90 or older. Now, among the assumptions you have to make are, first of all, how long will people in that group of 1,000 live? And of those who live, what percentage of them will have a long, protracted illness as opposed to a short, powerful illness? And that's referred to as morbidity. Like if they are debilitated for a very long time, as Alzheimer's patients often are, people suffering from frontotemporal dementia, Parkinson's, not so much ALS. The time period associated with ALS is not as great. But if you have these very long, lingering, or how about a series of strokes? You might live in a period, suffering a period of debility that could 5, 6, 7 years or more. Some Alzheimer's patients live more than a dozen years with that illness.
And as you as an insurer would be paying out for that 12,
That's right.
7 to 12 years.
So there's a few more assumptions here. One is how many people would actually, who are healthy, who buy the insurance at 50, how many of them are going to keep it? How many of them will just give it up after a few years and say, this wasn't really for me. Maybe I didn't need this. I mean, maybe they win the lottery and they say, I hardly need this. So they drop out. Then there's a couple of other things to consider. First of all, inflation. If there's inflation can eat into the cost of a service. It not only raise the cost of services, but can eat into the cost or eat into the amount of benefit that is left over. Insurers assume that of everybody who has a claim, not all of them will use up the full benefit. There'll be something called salvage, and they will then take that salvage and spread it around. Well, if there's a lot of inflation, maybe there'll be less salvage because people are going to have to use up more and more of their daily benefit to get the help they need. And then finally, on top of all of it, there are interest rates. And interest rates have a huge effect on premium adequacy because insurers will get a premium and they have to invest that premium. They have to be pretty careful with it. They can't just go into the stock market full throttle. So they often have to buy fixed instruments. And if the fixed instruments are not returning a good yield, then they have to charge more in their premiums because, of course, they're not getting the return that would allow them to discount the premium.
Right.
And that has happened during the course of the last 20 years. Of course, we've been in a historic
low interest rate. Yeah.
Mm-hmm. So these are the actuaries, when they're trying to price for something like this risk, they have to take all of these things into account. And that depends on data and, models. They have elaborate models that they build. And it's very hard to get things right because no one really knows what's going to happen in the future. No one knew that COVID-19 was on its way and that it would have a tremendous effect on virtually everything that's happened.
So the contract, the insurance contract, is written for a particular benefit. So, for example, it'd be written for a benefit of like a number of days of care, or a number of years of care, or all
Sure.
care for.
Sure. So typically, these policies will reimburse you a certain amount of dollars per day. Might be
Okay.
$200 a day, might be $250 a day, could be less,
Mhm.
and they would pay for it for a certain number of years. So maybe you have a 3 year plan or you have a 5 year plan. In the beginning, everybody, a lot of people, a lot of insurers were writing lifetime, unlimited
Mhm.
policies, and that turned out to be not such a good thing. And a lot of them lost a lot of money on those unlimited policies. Now, unlimited is a little bit more unusual. You have to pay a lot more for it. One good thing about the long-term care policies as they're structured is that if you have a $200 a day policy and you use on a Wednesday only 160, and again 160 on Thursday, and on Friday 170, well, you've just the $40 from the first day, the 40 from the Thursday, and then the 30 from Friday. All that money, $110 stays in your account. In other
Okay.
words, you don't lose it if you don't spend the full amount.
So when you were talking about insurance, if I had a plan, I signed up for a plan 5 years ago that would have given me a $200 a day benefit, but
Right.
now we've had so my contract's for $200 a day, and now I get sick, and we've had this massive inflation, and so nursing homes are now charging that 200 would have covered a full day's care, but now is
Right.
short. But I'm still stuck with,
Okay.
so I only
So
get the 200.
that's correct. However, most insurers offer you a couple of options on inflation. You can either do something called an automatic compound increase option, where your premiums are going to be higher, and your policy will go up by a certain amount every year. It might be 5%, might be 4%. It will compound by that much every year. There's what they call a future purchase option, where every 2 years they will come to you and they'll say, Mark, according to everything we have here, all the information we have at our disposal, long-term care costs have on average gone up 11%. Would you like to buy a certain amount of additional coverage? And if you do, here's your new premium. Some people will just they won't buy any protection. They'll buy a very high amount in the beginning. They might buy $500 and take their chance,
Mm-hmm.
with no insurance protection at all, no inflation protection at all.
Mm-hmm. And that would have been a good bet over the last 20 years or so,
Yeah,
but
not so
now
much now.
not so much. Everything changed very quickly. Um, the context of your article, you were proposing, I kind of want to circle back to this. You were saying how, like, in long-term care insurance companies write a policy, and then you don't interact with the beneficiary for possibly 20 years. And your argument in the article was maybe this isn't a good idea. What are you proposing?
Well, a number of things. First of all, I think that it's important for the insurers themselves to be involved in developments in the health care market and in healthcare research. Because if you're completely removed from it, you may not be aware of emerging technologies and emerging modalities of treatment, drug regimens, and so forth, clinical trials that could affect your perception of the long-term care risk. So if there are much better treatments now for Parkinson's, even as there are happily for pancreatic cancer, than there were, say, 20 years ago, you need to be tuned into that, because when you go to set your rates, you need to be aware of that. And you should not just be looking at the existing data that you might have on people who are already on your books. But I think that I would like to see, and I think a lot of companies now are starting to do this. They're getting involved in wellness routines, and the insurers have decided that rather than just leave the claimant to his or her own devices, that perhaps they will get a little bit more proactive in terms of going to them before they become a claim, maybe going to people who are in their mid 70s and, offering to a series of interventions, getting involved with, or beginning a dialogue that might lead them or their family to overhaul their living quarters so as to put up grab bars and railings and maybe to an electric stairway, looking at whether they've got pretty solid nutrition, looking at any repeated patterns that of health crisis that have to do with, say, certain, the mix of pharmaceuticals that might not be, some people suffer from polypharmacy, making sure that their eyeglass prescription is current, making sure that they have adequate hearing, because these are the things that can cause someone to take a very bad fall at home and to be left vulnerable for long periods of time. And we know that that has really serious implications. They may not be able to recover their independence after that. So it's sort of creating more of a dialogue with the insured and being more involved in the process of aging and the challenges that the insured is going to have, as opposed to simply saying, well, we saved you some money because we paid you a certain amount, or paid a certain amount of your claims. Thanks, and you should be grateful. I don't think that works so well, especially with a risk like long-term care. And you say, well, but Paul, that's certainly the case in life insurance. Yes, sure it is. In life insurance, it's very straightforward. You're either alive or you're dead. And there's no question about it. I mean, occasionally you have the issue of fraud. People pretend that they've died and they're still, they're in Rio or something. Right. It happens. It happens.
But that's not hopefully the norm, right?
No, it's pretty straightforward. But in long-term care, you see, it's very hard to determine how, to know how long people are going to be living and how long they're going to be living in a state of health or of relative dependence. And if you can do anything to change the outcomes, and we do know, for example, with diabetes, is adult state, second type 2, we know that to a certain extent is behavioral, that people they have habits that lead to that condition. And so, where things are behavioral, where they can be actually modified or changed, could make a big difference. Now, if you're talking about almost 70 million boomers are still living, can you imagine with, and I think some 30% of them are going to be at risk of having diabetes type 2. If you were to reduce the numbers, even by 10% or 20%, you're talking about billions and billions of dollars. And because of all of the, diabetes in its late stages is very expensive to deal with. So I would like to see the long-term care insurers turn a little bit back more in the direction of healthcare, get more involved in the dialogue, get involved in wellness, get involved in interventions where permissible and acceptable by the insured and the insured's family, and see if we can't start to bend the claim curve, because that will affect premiums down the road, and everybody will be better off. You'll have more intelligent underwriting. You'll have greater awareness of, how certain risks, certain conditions are being treated, and so forth. Does that help a little?
Yeah, it does. I mean, I think that sounds like a win-win kind of all around. I mean, nobody actually wants to have to use your insurance, right? I mean, nobody wants to go into dependency.
No.
So if at the margins, long-term care insurance companies could help reduce the probability of dependency, that seems completely reasonable.
And it's consistent also with, a lot of people have wearable devices now, and they're monitoring, their own blood sugar, their sleep patterns, their calories they're taking in, the amount of steps they take per day, and hopefully this will continue. And it's consistent with more of a partnership between the insured and the insurer. I mean, there are some people who have agreed to have these monitors put into their cars so the insurance company can, participate, monitor their driving behavior.
Yeah.
And if it's really terrific, maybe they get a much bigger discount than could be otherwise expected. Now, not everybody's going to want to do this, but I think, we're talking about improving outcomes here. And I think that these outcomes could be improved by some of these steps at least.
So is FedPoint engaging in any of these practices at this point, or is this something you're proposing?
Yes, I'm not supposed to talk about it because it's not
Okay.
launched. We are going to have a significant wellness initiative that will be launched next year.
Neat.
Yes.
So we were talking. You made reference to a New York Times article that I shared with you, which I will also put in the show notes. Article talks to a lot of the people who don't have long-term care insurance wind up having to spend down. Most people who wind up in a nursing home for an extended period of time wind up having to spend down. I mean, they have to spend all their assets in order to get care paid for by Medicaid. And Medicaid is one of the largest long-term care insurers, which is something I hadn't known until I started working here at UNH.
Yes.
And in order to get there, you have to spend all of your life savings, and basically, not entirely, but basically. And if you have a surviving spouse, you could leave your spouse basically destitute as a result. It's a really tragic thing.
Yes.
So how come we haven't changed? I mean, you saw this in the 80s when you started it, and it hasn't really.
If you talk to anybody who's been around for a while, and from time to time, I'll run into a couple of nurses who have a few gray hairs like me, and they'll. As happened last summer, I was someplace in Maine on vacation. I ended up talking to a couple of women who had been nurses for a long time. And one of them turns to me and says, nothing has really changed for decades. We are in the same situation that we were in years and years and years ago. How can that be? And I said, I know exactly what you're saying because I've been involved in this business for a very long time, and it's largely true. I think that several things. First of all, as you said earlier, a lot of people don't want to think about this, and they're thinking that they'll just die in their sleep, and they'll be carried away somehow very quickly, and they won't be a problem for anybody. Others, of course, just can't afford the premiums. They found the premiums that they looked at from time to time to be too much for their budget. Others perhaps had talked to a friend or a neighbor and they knew about Medicaid. Now Medicaid, of course, is carries the lion's share of expense for a very large number of people, particularly people who manage to spend down their assets. But it has some very keen critics who will tell you that people qualify for Medicaid without spending down everything they have. That some of them are able to, buy Cadillacs in the months before they go on claim because they needed a form of transportation. And there are various ways of, spending everything they have. So, and because people find out about this, they think to themselves, well, if the government is going to bail me out here, why should I take on the responsibility of shelling out $3,000, $4,000, $5,000 a year for this private protection? And there's no cash value. So if I buy my own private coverage for 10 years and I spend, $4,000, that's $40,000. And then if I drop it, I lose it all. Now you can say, well, you have the same protection, in a way on your house or your car. And you're very thankful that your house doesn't burn down, and that you don't total the car that you like. But a lot of people they don't see that somehow as equivalent. Now, meanwhile, the private long-term care insurance industry, I've been describing how it got going in the late 80s, really took off. And a lot of insurers thought they were going to, write tens of millions of policies. But then they discovered that they couldn't price it as safely as they wished. And some of them got into real serious financial trouble. And the analysts on Wall Street didn't like that at all, especially the ones that had that were stock owned. So that became a problem. Now, various governments have tried, people within government have tried, as the New York Times article described, going back to the days of Claude Pepper in the late 80s. Pepper had a plan for Claude Pepper from Florida had a plan. And then there was the so-called Class Act, which was became law for a short time and was repealed because it was deemed to be financially insolvent, or would be financially insolvent. Various people, Tom Suozzi out of New York, while he was representative there, had the Wish Act that seemed to be stimulating some interest, but of course it's dead. And then you have state programs like the one in Washington state and maybe perhaps one day in California. These are mandatory state insurance long-term care programs. They will take the money out of your taxes. You will get a basic benefit, not enough to cover all of your risk, but something. And there's a vesting period and so forth. And Washington State is moving ahead. That's actually law. That's actually in process. California is not. So I think that we have never really gotten serious about a national program for long-term care. I had hoped at one time that the federal long-term care insurance program might be a prototype for this. And others who work with me hope that as well. But we don't seem to have the resolve. And of course, now with the $32 trillion sovereign debt and an annual budget that is $1 trillion in the hole every year, who knows who's going to come forward and say, yeah, we ought to spend more money in order to cover this risk.
So most people are probably going to continue to hope to be able to either hope to have a quick end, or hope that they have the resources necessary to cover it. A lot of hoping involved.
If you can afford some amount of long-term care insurance, you are probably better off than not having any at all, unless you are really at the kind of close to the lower end of the socioeconomic spectrum, and then you're going to depend on Medicaid. But for most people in the middle class, having some will give you a lot of options, especially the ability to get your care at home, even to pay for friends and neighbors now. And some of the insurers have loosened up, and they'll pay a neighbor or friend to come in and take care of you as long as you can produce an invoice that says, yes, this person helped me for 6 hours. And, because we know that home and community-based care is less expensive than institutional care. I think you're better off. I certainly have it. My wife has it. A number of people I work with here have it. And I think it's a good idea for all, whatever its shortcomings.
Well, let's switch gears a bit and close on some discussions about leadership. You are a student of leadership. You're a member of the Churchill Society, amongst other things. We had a fascinating pre-conversation, and we share a lot of interests. So, given your study of history and literature, what is your leadership philosophy as a leader yourself?
Well, I can give you a few of things that I try to adhere to. And then what I'll do is I'll tilt that a little bit more in the direction of business or executive management, if that's
Sure.
okay.
That's great.
I think you have to have the ability to take qualified risks. I think a person who plays everything too safe is always wants to reach some kind of consensus or wants to have everybody else weigh in, and then chooses the solution that seems most popular, is probably not going to be a terribly effective leader. I think that you have to be able to take qualified risks, not foolish risks, qualified ones. I think the ability to challenge the people who are around you, whether it's your staff or your colleagues, not to simply go along with whatever the most people are saying. I think communication skills, very, very important. And not just being able to parrot a script. I mean, anybody can do that. Every company in America has a script. Every group has a script that they expect their leadership to recite. I'm talking about the ability to speak to people in a simple, straightforward language without cliches and without an eye to how it's going to affect the polls, whatever they are, or whether social media will like it or not. And then I think maybe also understanding the limitations imposed upon whatever position you hold, say the limitations of your own interests. You have an interest, you have some bias, you are part of the private sector, you're part of the public sector, you're an educator, but you realize that certain kinds of statements could be injurious to your own future prospects. I think understanding the limits, that really understanding them and not pretending that you don't have any, because we all do, but understanding what those limits are. And then finally, maybe the ability to listen. Very difficult for people in leadership positions to listen. Most of us are prompted all the time to talk, to give our opinion. So, it's said of Washington that he had many, many meetings in which he didn't say very much. He listened. Of course, I suppose if you were holding a meeting and you had Thomas Jefferson on your left and Alexander Hamilton on your right, you might not think you had a lot that you could contribute. But he had to live with those two guys.
Yeah.
And there was no question of who was the top dog. He was always the top dog. He had a real gift for listening. It said that during the Constitutional Convention, he sat there and took notes and said very little, but his very presence was enough to maintain sobriety and sanity and mutual respect. And but very difficult to listen. Very difficult. I try really hard. This is something that I feel I need to work on a lot more. I have a couple of guys that I really admire, and of course one of them is no longer with us, but it's Peter Drucker. And I don't know if you're familiar with Drucker. He was an Austrian that came, and he was out at Stanford for a long time, and author of many, many books. But I love many of the things that he says about how executives lead, and I also like a lot that Tom Collins has said, who followed in Drucker's footsteps. The author of Built to Last and Good to Great, many other books.
You are a lifetime student of the liberal arts, starting all the way back as an English major at UMass. Yeah. How has your ongoing study of the liberal arts and various shapes and sizes influenced your leadership and your work in the business world?
Well, I don't think that we can ever read too much. And I think that if we read only within our particular discipline, whatever that is, it's insurance, it's finance, it's engineering, it's healthcare. If all we do is read within that discipline, we are not going to develop all of the tools or perspectives that will be necessary to deal with people who are different than we are. who think differently than we do. We won't be able to understand them. We won't be able to communicate with them. We'll lose the opportunity of benefiting from their insights because we won't be on the same wavelength. I think that read as widely as we can. I mentioned in the beginning, my habits of reading in an interdisciplinary fashion, but also, of course, trying to read different perspectives today with our divided electorate, reading both sides of the aisle. I try to read the Wall Street Journal, and I try to read the New York Times, and I try to read, the Atlantic, but I read other stuff that coming from, more of a right perspective. So I think those things are important because I don't see how you can be effective if you have a very narrow and partisan viewpoint. Also, I think that as I was thinking a little bit about this question in relationship to the film Oppenheimer, which you may have seen.
I actually haven't seen it yet, but I hope to. So
yeah, and one of the things that takes up is this whole question of whether the STEM disciplines, whether technology is adequate to manage itself. The answer to a lot of advanced technology is more technology. But how do we know whether technology is ultimately going to be good for us as a species? And I think that this is one of the insights that Oppenheimer had. I think he believed very strongly that we needed the humanities, not so much as a check, say, on the impulses and developments of technology, but as a way of evaluating whether the technology that we had was going to somehow be consistent with humanity. And so when I hear about schools that are, closing the departments of English, like that place up in Wisconsin, I forget who it was. There's a school in Wisconsin that did that, and all these people calling for reductions in humanities staff and so that there's more money and more facilities for STEM. I get a little worried, and I should add that I came from a very, very modest background, very modest. My parents were working class, and they had very, very little in the way of resources. And they had no influential network, and they did not attend college. So, and they were both champions of STEM. When I was growing up, STEM was everything. But so I suppose I might have been a disappointment to them. But I believe very strongly that we cannot live by STEM alone.
Your point about Oppenheimer, it made me think of today. We're seeing the advent of large language models, ChatGPT and so forth, and it's just. I realize machine learning's been around for a while, but I think we've all in the last year since ChatGPT came about kind of had a bit of a rude awakening. Those of us that really don't have the deeper understanding of machine learning to now see, oh, wow, this thing is, I've played a little bit with it, using it to like write some short papers, just to having it write some short papers. And I'm just like, this is actually pretty good. Like I'd give this, if this was I would give this an A from an undergrad, it's not a brilliant piece of work, but it's well organized. It's, it's just, and I just think that, we need to, I think there's an element of the humanities that's definitely got to be retained as we play with this new technology that I think is going to be as transformative as electricity.
Yeah, if for no other reason than for defensive purposes, because how will you be able to evaluate whether something is authentic, and that is to say, human driven, or it is the work of machines? This could be very dangerous if too much of our public dialogue is generated by or controlled by machines, then we may not be able to, it reminds me, we won't be able to control actually our own dialogue. And it reminds me of the kind of stuff that Orwell talked about so brilliantly in 1984 with the principles of Newspeak, where he was really tuned into the ways in which language could be used to control people, especially prefabricated kinds of language, scripted language, in turned over in many, many different ways, but always within a kind of closed loop, and the very harmful effects it could have on independent judgment, independent thinking, democracy. So I think that for that reason, for no other reason alone, I think Richard Hooker is still relevant. Because I think if you can read Richard Hooker, you can probably pick up on, the ruse somewhere.
Well, let me close on. So I teach undergraduates primarily here at UNH, all of whom have indicated an interest in working in healthcare. Why should they be thinking about insurance? Why should they be looking towards insurance? Maybe long-term care insurance, something along those lines. Why would you recommend the field?
I would say that insurance is very, very important because it is a fundamental way of spreading around risk. And without it, we cannot really function very well as a society. We have an enormous amount of demand now for healthcare, and not everybody can, of course, afford to pay for it. And if you don't have some mechanism of laying off some of the risk that you personally have, then you're going to be in real trouble, whether it's in healthcare or in long-term care. But further, there are different ways that once there are ways that the insurer itself can manage the risk, can spread it around, can perhaps share it with reinsurers. Now private equity has entered the market, and it actually has sizable positions, not in long-term care, but sizable positions in both life insurance and health insurance. So I think that it's going to be, in the future, increasingly important. Also, it's a business that is not easily mastered. And so if you get into it and you find that you have some aptitude and some interest, it's going to be around for a very long time. You may not work for the same insurance organization forever, but you will almost never find that your skills are not needed at some point in the future, even if the entity that you started with, were to become, for whatever reason, unsatisfactory to you. There will be other opportunities. So I would say it's inherently interesting. It's challenging. It's important. In some ways, it's the glue of civilization. We couldn't do anything unless we had felt that we had some of the risks that we assume every day taken, backed by somebody else. And so I hope that gives you some kind of an answer.
It does. It does. Paul, thank you so much for your time today. This has been a really great conversation.
What a pleasure. Thank you so much. I hope that your listeners found something in this session to be of use.
You've been listening to the Health Leader Forge. Please go to our website, healthleaderforge.org, for more information or to leave comments about today's podcast. Look for Health Leader Forge podcasts on iTunes, Stitcher, SoundCloud, and other podcast distribution sites. Thanks for being a part of the Health Leader Forge community, and we'll talk with you again soon.